Thank you. It's my pleasure to talk with you about trends in practice settings among ACOG fellows during the past 20 years. Selection of a practice setting is very, very important to us all because that affects what type of practice we would do, in what setting, the amount of autonomy we would have as practitioners, as well as our salary and administrative responsibilities. What we've done in this investigation is looked at the last 6 surveys of our fellows, which involve the performance liability survey, which is conducted approximately every 3 to 4 years. As you look at the results dating back to 1992, there's been a gradual trend in private practitioners being fewer in proportion to the rest of the ACOG fellows, especially with that blue line, which represents the solo private practitioners. Instead, there's been an increase in the number of employed ACOG fellows who work either at hospitals or in academic faculty settings, or perhaps in government offices. So what we've seen here is a trend toward fewer of our fellows functioning in smaller private practice settings, especially in partnerships as well as solo practice. There's indeed a trend in all the specialties, for that matter, to work in larger organizations where people are employed. The value for this is it allows one more security with regard to anticipating what would be their expectations of their practice, as well as what would be the expectation with regard to a work-lifestyle balance. It's also important to function maybe more in that environment as we undergo healthcare reform and try to better understand our role along with insurers and health maintenance organizations with regard to what are the needs of our patients and how can we better meet those demands, often in a larger practice setting.